without trying, without learning and being curious, we aren't going to move forward. So I would say if you doubt it, study it, learn it, and figure out where the gaps are and be a part of the change.
Hello, this is Zach McConnell with the American Journal of Healthcare Strategy, and you are listening to the Clinicians and Leadership podcast series, where we focus on empowering clinicians from the bedside to the boardroom. Today, I have the esteemed honor of being joined by Dr. Trushar Dungarani. Dr. Dungarani, why don't you take a second to introduce yourself? Tell us a little bit about your experience and your current role.
Great. Yeah. Thank you for having me. So my name is Trushar Dungarani. I'm the director of clinical and data science at MD Clone for our North and South America divisions. And my background is in internal medicine. I'm a physician. I practice hospital medicine. And in the beginning of my career, I was in New York City. I worked at Northwell, Lenox Hill. And my journey started with in an academic setting. And so I taught a patient safety curriculum. I led a hospital medicine group there. And then I transitioned to Maryland, where I worked in the Johns Hopkins health system. And in addition to clinical care, I had a big role in our community division from both a quality and operations standpoint. And my focus is really to leverage people, process, and technology. My favorite part of working there was working on high value care delivery for the health system. And I got the opportunity to work in machine learning projects, work as a physician advisor, and I chaired a health information management committee. So all that summed up, I know the beauty and the dysfunction of a healthcare system very well. Currently at MD Clone, I'm focused on working with healthcare organizations to empower them to use their own data, whether it's original or synthetic, to be able to create change, whether it's putting out a research paper or driving a quality or operational case, and making sure that patient data is safe but still usable.
Well, Dr. Dungarani, we're grateful for you joining us today on the Clinicians and Leadership podcast. And particularly, I'm excited to get to talk to you and to pick your brain. You've got a unique collection of experiences in a variety of different areas, both serving as a clinician in internal medicine, teaching, you mentioned that, but also I'm interested in the interplay between those and your more recent work interacting with data. And you mentioned synthetic data. We're going to dive into that and what that is a little bit later. But particularly, I love the way how you described your role is kind of stepping in and empowering organizations to use their data that they have well. And so as a result, that necessitates that organizations like you described aren't using their data well. And so what are some of the biggest barriers that clinicians face today in accessing and utilizing like real-time, high-quality patient care data at the bedside? What are some of those biggest barriers that you help these organizations navigate?
Yeah, that's a great question. I was just talking to my colleague. We were wondering, why aren't people using more tools? I think it starts with our training. Whether you're a nurse or a physician, we're not taught to use data in a very, systematic way, or we don't have access to data. So they're not telling us, hey, when you start your job, make sure you get this data set, make sure you look at all these variables, because it's just not accessible. And so off the bat, we are not in that mindset of asking for things. We're given reports here and there, and we're supposed to interpret it and make decisions with very few data points. When you come into a health system, they may have started on paper charts and then moved to one EMR and then the other. So there's a lot of data fragmentation. And so when you're at your latest and greatest EMR, that EMR doesn't contain legacy data. And so what do we do? How do we study things over a long period of time? The other part of it is workflow. If you are working in the ER, you may not know what's happening on the inpatient side, but anybody who has done hospital operations understands the ER is impacted by the inpatient unit and vice versa. And so studying it, working in it, and understanding the kinks and the nuances of it is a barrier for people, especially early on in their career. And I think probably lastly is there is an inherent distrust in data. If you are told you are not doing well and your patient experience scores are low or your patients are getting readmitted, there's always a kind of a defensiveness to it because these clinicians aren't getting access to data. So they're being told something without that ability to see the data. And so we have to ensure as a health system and as a kind of a broader healthcare delivery network that we have to teach our providers and our clinical team members about data, give them access, and let them make changes for themselves.
Well, I think that's such a key point, Dr. Dungarani, that you brought up, and just the lack of access that some of those frontline medical workers can have to the data, particularly when you're talking, clinicians and more specifically physicians, that they are some of the best in the world at taking data, interpreting it, and then planning next steps, because that is what not only have they went through all those years of school and training to do, but that is their job. And if they don't do that job well, then patient care suffers, and ultimately they're out of a job. And so it's not utilizing the skill sets of your medical staff to the fullest, to when you're not equipping them with that data, and not giving them access to that data. And so, kind of coming off of that, we talked about some of those barriers that organizations may face. But kind of on the flip side, how can your clinicians and leadership and other leadership ensure that those frontline providers do have access to that data, that they are engaged, that they are equipped to use those tools that you mentioned a little bit throughout that last answer, to use those effectively? How can they ensure that they're equipped to do what they need to do?
Yeah, that's fascinating. Thinking about what does it take? Is it just access to data? Is it teaching them something? And I believe it starts with leadership, right? You have to have a team of people who believe that if we want to be the best in the world, we need data. We need to follow the data and make sure we can interpret it in the right way. And so you need tools. You need a process to say, all right, am I going to expect um, my cardiothoracic surgeon to make a decision about why the OR is taking longer without giving them any tools? No, you have to give them the time, you have to give them the access to tools, and then encourage them to find the issues. Everything starts with culture, and if you're going to create a change in a healthcare system, it's multidisciplinary. And if you give them the tools to find the problems, they are much more willing to create that change versus somebody top down saying your OR throughput time is terrible. You have to change it. Go tackle it. And then you're kind of stuck there with a few data points, and you're kind of guessing on what really needs to change. So it starts at the top. You have to give them the tools, and then really start to learn, create that culture of learning. And every year health systems ask, are you given the right tools to do your job? And I think consistently having access to data is one of the biggest challenges in healthcare.
And that, Dr. Dungarani, I think is a fascinating area where particularly your clinicians and leadership can step in, because you've got administrative teams that have the data. They may not know exactly how to use it, or maybe not know exactly what it means, but they are the ones that are gathering that data. And then you have your clinical staff that are making the decisions for the patient care, and both of those teams need to work together. And far too often there's a gap in between them, and that is where I think your clinicians and leadership can step in. And so before we dive into kind of the rest of our talk, I'm curious to hear your thoughts on how clinicians and leadership can build and bridge this gap between administrators, IT, data science teams, and the frontline commission or clinicians, excuse me, to maximize data usage, and then as a result promote high quality patient care. How can those unique individuals with the clinical and administrative experience bridge that gap effectively?
Yeah, I think it's a few things. One is a common language of all right, let's make sure apples are apples, oranges are oranges, and a physician may not interpret data the same way that a quality department looks at it, or the pharmacy team and the CFO look at cost at a very different standpoint. So making sure that we get on the same language and the same set of rules. And though the priorities may be different for different groups, there is a common language of, hey, we want to do this specific intervention because A, it's going to save us money, it's going to improve patient care, and it's going to change the way we're delivering care in our health system. And that's something that different types of groups can really attach to. Um, I think the other part of it is, how do we create that incentive, that motivating factor. Some people are motivated by praise. Sometimes it's getting time to put out a research publication. Um, in other ways, people love hearing patient stories. It makes them feel good about why they're in this field. So we really have to tell a variety of stories so that different types of people in different types of roles can really build on that mission to drive forward. Um, and I think the other part of it is, a clinical workflow and a clinical story can be very different from a data journey. Um, the assumptions and the expectations of how data flows with a patient story, need a lot of communication. And just like changing something on the floor requires a multidisciplinary team, you need that same type of team to really communicate how that data is telling that story, because there is a lot of data in that EMR, whether it's your current one or legacy one, and we have to make sure that we're telling the right story.
One of the things you mentioned earlier in really, I think it was your first answer, or just telling us a little bit about yourself and your experience, was this concept of synthetic data. And so I'm willing to bet that there's a number of people out there that don't know what you mean when you say synthetic data. And so I guess my question is, what is synthetic data, and how can clinicians and leadership be confident and build confidence, so not just confident themselves, but also build confidence in the staff that they're working with regarding the accuracy of synthetic data? So what is it, and how do we build confidence in it?
I think the story of synthetic data, and we'll just talk about it in healthcare, is, why do we have synthetic data? Why is it even a topic? And and I would say the few items that make synthetic data important to think about and conceptualize is, we are trying to protect patient privacy, right? That's the number one. Let's not expose data. The other part of it is, we need data to make change. In healthcare, to look at original patient data, you need to go through regulatory steps to use it. And rightfully so. We don't want everyone having access to all of the data, because we want to be judicious about that process. So now, jumping to what synthetic data is, the current standard for protecting privacy is de-identification. So that means we're going to look at 18 variables that are deemed to be high risk, whether it's your name or social security or your address or your zip code, and we're going to pull that out and then give you the data set. Now, does that ensure privacy? Not necessarily. There's a lot of talk about how de-identification doesn't really protect it in the most complete way. And so now, when we look at synthetic data, it's an artificially generated data set, but it is scrambling the data around so that you can't look at one row of data and say, this is all the characteristics of one patient. But what you can do is say, the statistical properties of one column are exactly the same as the original patient data set, when you're comparing things like age and the risk of diabetes, or how long did they stay in the hospital, and what zip code are they coming from. So we don't have to necessarily take away data. We just scramble it in a way so that we can still use important data features to make change for our patients.
So I'm curious, coming off that, you walked us through, and I thought that was a great answer just on what synthetic data is and how it can be used. But I'm curious to dive a little bit more into the role that synthetic data, particularly the privacy protected synthetic data sets, what role that those sets play in clinical research, and how do they compare to the more traditional patient data sets that organizations use, and particularly in terms of reliability and effectiveness. So how what role does it play, and how does it compare?
Yeah, yeah. So if you think about, at the end of the day, you're trying to get insights and protect privacy. And so if you protect privacy too much, if you extract too many data points from there, you're not going to get insight. And on the flip side, if you kind of leave the floodgates open, you're not really protecting patient privacy. So there is a balance there. Um, and so that right balance is are we going to protect our vulnerable populations? Maybe it's a rare disease or something, a very small amount of community members have, or maybe it's in a specific geographic region. We have to ensure that we are not exposing that. And so with synthetic data, you can do that by scrambling the data around, and there are limits on what and how you can study. There are strategies to mitigate small populations, but the endpoint is let's make sure that we're keeping their data safe and private. So the benefits of synthetic data right now in the healthcare system is, I don't have to jump through a million hoops to look at whether my study is feasible. It may take weeks or months to get a data set to even see if your project is viable. Do I have a magnitude of patients to do this research project, or create a new service line, or make some sort of quality or operational change? What if we could speed that process up, get insights about our patients, and then say, you know what, I might need original data, so let's apply for IRB or REB to get that data. And now we're not wasting our time with 5 or 10 ideas that may take weeks, months, or years to get a data set for. Now we can test this ourselves and get the answers so that we can make the most of our time. Um, the other part of it is health institutions have limited resources. To get data today, you need to ask an analyst to pull a data set using SQL, and some health institutions have 5 people or 10 people for 10, 20, 30,000 employees in there. So you can imagine 95, 97% of people aren't asking for data sets because they can't wait in line. They're not going to get prioritized, and it just takes too long to cycle through that. So if we can empower our team members with self-service data to answer these questions, then we are making more efficient use of our analysts, of our team members, and we're actually creating a learning system.
And I think that's such a key component, and that just speaks to I mean, what you mentioned at the beginning of our conversation is empowering those organizations to use the data that they already have, and just being just super clear as well. Synthetic data is not you're not making anything up. You're simply just allowing organizations to use that data to the fullest extent that data allows, and that is such a key thing, particularly in the field of healthcare, which is such a data driven field. And if that can speed up that process for any small number of things, that those small number of things turn into big number of things, and that's really how change can occur. And um so there seems to be a ton of benefits to utilizing synthetic data and utilizing it well. And so I'm curious though, do you have any examples where synthetic data has driven innovation, whether that's in clinical research or predictive modeling, operational improvements, just an example where synthetic data has driven innovation within the medical field?
Yeah, absolutely. So I'll say, with some of the clients that we're working with, we've used synthetic data in a number of ways, whether it's trying to predict what type of chronic kidney disease patients are going to progress to dialysis, and what can we do? What are the real predictors of those types of patients, going to dialysis? Dialysis, as some people know, it's a huge change in your quality of life, it's a huge cost burden on the health system. And wouldn't it be nice to figure out, why these patients are progressing so quickly? How can we stop them? How can we create a service to change that? And so, predicting how chronic disease populations are going to, go to their, I guess, worst outcome, or the outcome that we're trying to avoid, and being able to study that seamlessly and add data and remove data, if you have access to it, in a safe way. Another example is we worked with another health system looking at cardiac patients. Can we predict which patients are going to lead to more severe heart disease or heart failure? And we can actually use synthetic data to create machine learning models, and it's been validated. It's in the research, and whether you want to use synthetic data going forward or prove your case, right? Like a lot of companies out there, their struggle is they don't have data. And if you could use synthetic data to test out your tool, we can increase the speed of innovation, right? Before you actually get into the original patient data.
Well, and Dr. Dungarani, I love both of those examples because both dialysis as well as the cardiac issues, those both have dramatic impacts on patient life, on their life, and as well as they have dramatic impacts on healthcare systems and organizations that are providing care to those patients. And I mean, if synthetic data can step in and provide insights and direction in providing better care for those individuals and preventing those worser outcomes, then as a result, everybody benefits, both the healthcare systems as well as those patients. And I think that is just such a great example of why synthetic data can play such a key role, not just in those specific examples, but just in healthcare across the board, is because it can make significant differences both for the patient as well as for the organization. And so, um, another area of focus that is becoming more and more prevalent and requires more and more attention are gaps in healthcare equity. And so, I'm curious, can synthetic data play a role in addressing these gaps, particularly when you're looking at underrepresented patient populations? Can synthetic data step in and provide additional insights to allow your healthcare organizations and clinicians to provide better care for those groups of patients?
Yeah, absolutely. We talked a little bit about de-identification, and that's the current standard of removing things from a data set. I think synthetic data allows you to work with sensitive data in a safe and much more guarded way, so that you can get those insights. We worked with a few clients looking at heat maps, and are there geographic concerns around global warming, or other types of environmental issues, and which type of patients are living in these areas, and are we seeing disparities in chronic disease or cancer modeling. And so whether looking at large populations, or even looking at your own health system and saying, all right, let's look at a common surgical procedure like a hip fracture. Are all our patients going to the OR at the same time? Maybe we can put in ethnicity or language and figure out, are we slow because of language barrier? Are there some other types of disparities that we need to look into further with with ethnicity or race? You're able to do that with synthetic data, and start off with a great deal of insight. And with our platform, what I love is we can ask a question, find an insight, and with anything in healthcare, there are 10 more questions or 20 more questions. And so, having that self-service ability to look at data, look at synthetic data, and ask more questions, and really have this dialogue with data, is really the power of our platform and the power of having access to data.
Well, and I loved how you finished that last one on just the synthetic data gets the ball rolling. It gets the initial questions asked, so then you can ask more and more questions, and really that is the innovation process, that is the improvement process, particularly in healthcare, that you're always trying to do. Thank you, Dr. Dungarani, for joining us today. One last question before I let you go, and I promise I will let you go after this question. I know I've peppered you with a lot of questions, but for individuals, particularly your clinicians in leadership who want to champion synthetic data, who want to champion data analytics and innovation in their organizations, what advice would you give to those individuals?
I think we talked a little bit about what are the ingredients of cultivating that culture, and we talked a little bit about leadership and access to tools. I would say the biggest thing is data literacy, right? Like our clinicians know clinical workflows, and then our IT and analytics team, they know like the data workflow. So developing that kind of common language of data literacy, teaching them, and I would say out of all the industries, healthcare has the lowest data literacy by far. And so, why is that? Why is that so? Our teams are in front of the EMR. I'm sure if you've gone to the doctor's office, your doctor or nurse, looking at the computer, typing in all of these things about what you said, and your weight and your height and your medications, and all of this data goes in there, right? And we don't have a great way to pull it out, unless you're working together in a concerted effort to break down silos of data or people, and and then you need to have this data dictionary so that people understand what they're using. So I think it starts with data literacy. And I think the other part is that curiosity, right? We are in the forefront of AI. A lot is coming out there, and there's a lot of skepticism. But without trying, without learning and being curious, we aren't going to move forward. So I would say if you doubt it, study it, learn it, and figure out where the gaps are and be a part of the change. Because it's not perfect now, it won't be perfect in the future, but we need our health team members to be engaged with where AI and machine learning and data is going.
Well, Dr. Dungarani, thank you for joining us today on the Clinicians and Leadership podcast. We're grateful for your insights and your experience, and just the ways that you are um, advancing and empowering organizations to use data to the fullest, and just the change that is going to happen in healthcare because of your work and the organizations that you work with. And so thank you for joining us today, and we wish you the best.
Yeah, thank you for having me, and yeah, we appreciate all that you're doing to talk about healthcare